If your child has mild symptoms of a respiratory illness, I suppose your first port of call will be your GP, and your GP is best able to advise then of what are the next steps to take, whether that's come to the emergency department or whether it's minding and managing your child's symptoms at home. So if they're coughing, sneezing, a low grade temperature, and but they're still feeding okay and they're still having a good urine output, and their colour is good and their breathing looks good, then it's okay to manage them at home and just bring them to the GP for review. So we would always explain the red flags to parents and the things to look out for if we're discharging a child with mild symptoms. So that would include watching their intake, so watching their volumes of the feeds that they're taking, making sure that they're taking more than half of their normal volumes of feeds. If they're taking less than half of their normal volumes of feeds, we would always ask them to come back or advise them to come back to hospital to see us. So the general advice if your child is unwell over winter time would be to keep visitors to your home at a minimum. And I suppose especially if those visitors are symptomatic or if you're symptomatic yourself. If you are symptomatic in your home around your child, it's really important to wash your hands regularly and avoid kissing your baby if you are coughing or sneezing. Avoid bringing your baby to large crowds as well where people may be symptomatic, because a lot of these respiratory illnesses are spread through droplets.